Gather all your equipment together on a table, have your wipes ready, and a trash can nearby outside the door. Start by placing either a surgical cap or bonnet over your head. If you do have long hair, please assure it is tied back prior to placing the cap. Next, perform hand hygiene. Once hand hygiene is completed, go ahead and pick up your disposable clean gown and place it over your head. Assure that when you slip your arms through the sleeves, that your thumbs are going through the loopholes of the gown. Now assemble your cap or helmet. Place the pads in the front and the back of the helmet in the Velcro area. After placing the pads, assure that the headband itself is extended outward fully by turning the knob on the back of the helmet. Now, plug in the battery pack into your helmet cable. You will notice all the lights on the front of the helmet turn on as it is doing its self-test. After its self-test, the battery life will be indicated by the green lights. If the green light goes from green to red, please replace the battery as soon as possible, as there is only approximately 15 minutes left. Now attach the shield to the helmet using the 3 pins on the front of the helmet to secure it in place. Using gentle pressure, place the shield against the white part of the helmet and make sure that it lines up and there are no gaps. Once the shield is attached, remove the film covering on the front of the shield by grasping the pull tab and pulling it across the shield. Once the film is removed, please throw it away in the trash can and continue. Assure that your glasses are adjusted appropriately before putting the helmet on your head, and then place the helmet on your head, adjusting the knob to assure the helmet will not move once you have put it in place. Then pull the film covering down under your chin. Now make sure that the plastic tabs are appropriately pulled back on each side. Next, run the battery cord through the back of the gown. This will prevent the cord from catching on things and snagging while you are working. Now, connect the battery cable to the battery pack and place the battery in your pocket or clip it to your scrubs, whichever is more comfortable. Assure that the gown is covering the battery pack so it does not get dirty. Now tie your gown in the back, assuring the cord is tied into the gown. Do not tie the gown in front, as this may cause problems during the doffing process. Now perform the nod test by rocking your head back and forth to assure that the helmet will not slip when you move your head in the room. Now place your gloves on your hands and assure that the thumb loops are securely in place prior to the gloves going on. Prior to entering the patient room, please do hand hygiene. Once hand hygiene is completed, you are certainly able to enter the patient's room. Provide all tasks that are needed to be done and all care that needs to be given. Please remember to do hand hygiene after completing each task. If doing any tasks such as pericare and you deem it necessary, you may double glove for these tasks. Once you've completed them all, please do hand hygiene again. To exit the patient's room, please walk to the doorway and begin the doffing process. While standing next to the trash can by the doorway in the room, lean forward and grab hold of your gown at the hips. Assure you have a good grip on your gown and pull slowly forward until the ties break in the back of the gown. Remain leaning forward during the doffing process. Then grab and gather the gown at mid-chest level. Pull the gown forward until the gown breaks. Make sure that you do not let go of your gown at this time. Grab hold of the gown and rotate your hands inward over the gown, so it is turned inside out with the hands now covered by the gown and clean surface now covering your hands. Reach up with the clean side of the gown and grab hold of the attached part of the gown on the shoulder. Pull gently until the neckline of the gown breaks. Pull the gown down over your hands so the sleeves are inside out. Do not pull the gown off past the wrists at this time. Begin to slowly ball up the gown, folding the dirty side into itself. After the gown is formed into a ball, use the clean surfaces of the gown and your thumbs to remove your gloves. Take your thumb of your hand and put it in the opposite glove cuff and remove it gently. Once you have your gloves free, go ahead and drop your gown ball into the trash can, and please do not throw it. Upon exiting the room, immediately clean your hands. Close the patient room door and don clean gloves at this time. Remove the Clorox wipe and set it on the table. You can also remove the hydrogen peroxide wipe at this time if that is more convenient. Remove your helmet by unscrewing the knob. Hold your helmet so that it does not touch your scrubs or the table. Grab the Clorox wipe and wipe down the top cap of the helmet. Then also wipe the band down and the knob which you've turned. Grab the cord and wipe it down as well, all the way down to the battery pack. Throw the wipe away. Then grab the hydrogen peroxide wipe and we're going to clean the shield off. Clean the front of the shield off and the underside where the plastic would be towards the outside, towards the patient. Throw that wipe away. Once that's cleaned, you should be able to set the helmet down. Make sure you detach the battery cable from the battery or pull it from your pocket. Make sure that the battery pack is cleaned off prior to being set down on the table. Once the visor is clean, go ahead and perform hand hygiene again. Once that is completed, remove your gloves and perform hand hygiene, and you may continue with your care of other patients.